Ho Chi Minh City native Locke Phan, our team visionary, was fortunate enough to be raised by a supportive family and enjoy an advanced healthcare system. During the summers, Locke stayed in Vinh Long, a rural area located 93 miles away from the city, to visit his relatives. However, one summer when Locke returned, his life changed. He witnessed his uncle describing hallucinations of deceased relatives and being auditorily disturbed at night. What he witnessed were symptoms of schizophrenia. Despite the severity of his uncle's disorder, Locke's family was unaware of its consequences. Upon taking Locke's uncle to the local hospital, he was dismissed. Lacking psychiatric knowledge, the local medical professional incorrectly explained that his symptoms were the consequence of overwork, and they suggested getting more sleep. 2 months later, his uncle's untreated symptoms worsened, and he had to travel 93 miles away to reach the nearest psychiatrist. He was then diagnosed with schizophrenia, but due to delayed intervention, his disorder currently persists. Locke explained to us that people living in rural areas do not have many options regarding mental health care. As of 2004, there were only a few hundred psychiatrists in the entire country. Since 2004, this number has only worsened. Separated by geography, people in rural areas pay high fees to travel to the nearest state hospitals. In parallel with many other cultures, Vietnamese people tend not to consider mental disorders serious. People typically seek cheaper traditional medicine, which is not scientifically credible, and going to see a psychiatrist is a last resort option. Limited numbers of medical professionals, geographic struggles, and traditional beliefs all harmfully compromise the treatment outcome of ongoing psychotic individuals. Vietnam is not the only country with this problem. Schizophrenia can affect every human person globally, and as long as there are rural areas with less access to healthcare, then our tool can be relevant. SchizophrenAI's aim is to bridge the gap between patients, untrained clinicians, and psychiatric doctors by providing a public platform as well as an integrated AI tool for clinicians and doctors only. Looking into the gold standard of assessing mental health conditions, DSM-5, we can see that many of the criteria clinicians use are subjective. As a result, diagnoses can vary between clinicians, and the problem is severely exacerbated in countries where untrained clinicians are the first people to examine patients. To combat misdiagnoses and reduce subjectivity, SchizophrenAI aims to provide clinicians with subjective tests to help inform their diagnostic decisions through the use of artificial intelligence.
The SchizophrenAI prototype relies on two key processes, the first being calibration. To align to the pre-trained ridge regression model, we use mouse clicks to calibrate your eye movements to your screen. The full calibration requires you to align your gaze to 9 points. Once calibrated, you're able to take a multitude of psychological eye tracking tests. To demonstrate, we'll show you the anti-saccade test, which requires you to concentrate your gaze on the center dot, and then when a dot appears, you are to control your gaze to the opposite direction of the dot. As studies show, people with schizophrenia have more difficulty with this test. Once the test, which consists of 20 trials, concludes, you will receive an error rate in the corresponding resources to allow you to compare your score to important studies.
Once users visit our website, patients will be presented with resources that they can utilize, and professionals will have the ability to log in. Once a professional logs in, they will see a dashboard outlining some information that may be useful to them, and they can also begin a new test for a patient. When they begin a new test, they can work with the patient to fill out the first name, last name, which will be required, and then any other information that the patient is able to help fill out. And once this information is filled out, they can continue to the test, and the patient can take the test as was demoed before. And once the tests are complete, a report will be viewable for the professional where they can view each task and the patient's score on that task and be able to see if it was a healthy score or a schizophrenic indicator, which can help them make their final or any recommendations for the patient. We hope that this platform will help many people who need assistance and are not receiving the help they deserve. This tool will allow the medical and non-medical staff to come together to help make an informed decision on whether or not a patient has schizophrenia.